Shall we start, Gaurav?
Yes, sir.
Okay. All right, my dear friends, welcome once again. Thank you for joining today. Usually we do these webinars on Thursdays and Sundays, but tomorrow I have a function to attend at Spandan, the residential rehabilitation center we have in Mumbai. So I'll be occupied with that. That's why we are just doing it today. So welcome. My name is Dr. Alok Arora. I am clinical psychologist and director with JKP Care Foundation. Today on 13th of May, 2026, we are going to talk about silence. Silence? Does somebody talk about silence? Yes. Today we are going to talk about silence and going to create a loud noise for it. So after this webinar, I would like you all to go places, talk to people, talk to the mothers or the parents of special need children, talk to the therapist about silence in autism. So I expect you to create a loud voice, a noise about silence. So what silence is? What do I mean by silence? And what is the role of silence in autism? Is it the noise I'm talking about? The first instant comes noise. Yes, children, there are some children who are auditory hyperactive and they don't like that noise. Am I talking about that sound around me? Or is it something different? Let's look into it. I will start with my presentation and towards the end of the presentation. So in 45 to 50 minutes approximately, I'll be presenting you my slides and I'll be talking about the subject. And post completion of presentation, I'm open to the questions also. So if you have questions, keep writing them in your YouTube live, keep putting them there, and the coordinator would read it for me or would send it to me after the session is completed. I mean, the presentation is completed, and we'll take it ahead from there. So let's look into what silence has to speak. What silence has to say about autism. What is silence role of silence in autism? I'm just starting my presentation. Allow me a minute. Meanwhile, I want to remind you all that we have these webinars open for everyone, for parents and professionals on different topics in autism. So today we are going to talk about silence in autism. And every Thursday and Sunday, we do these webinars at 8 p.m. India time, 6:30 p.m. UAE time, Mauritius time, 6:30 p.m. Or you can check, if you're from other countries, you can please check on Google or check with your country's zone time. So 8 p.m. India time on Thursdays and Sundays. Today is the exceptional day because I'm not available tomorrow. I'm doing it instead of Thursday, I'm doing it on Wednesday. So many children with autism are not refusing the world. They are overwhelmed by it. Sometimes the greatest therapy begins when the world around the child becomes silent enough for the brain to feel safe. That is what I mean silence. Silence means safety for the brain. Now, if you people who are regular to my sessions, who have seen the previous versions, they would remember a child called Chinu. Chinu came here and spoke to you about Chinu's own struggles. Chinu is a child who is with autism. Today, the child again wants to come and talk to you about silence. People who are not aware about who Chinu is, you may go back, you may go to my YouTube channel, which is at the rate DRALOKARORA, Dr. Alok Arora, without dot and space, and see the recording. Recording is available on my YouTube channel about Chino. So I think the topic is stress and depression in autism. There on that topic, you will connect with Chino. So the silence, not only external silence, but also emotional silence, nervous system calmness, reduced sensory overload, mental regulation, calm communication. predictable environments, and inner brain organization. This all states. So, silence, I don't mean by noise. Noise is part of it when it comes to sensory regulation, but not only the noise, but emotional silence, nervous system calmness, reduced sensory overload, mental regulation, and calm communication, the way we communicate with them, predictable environment, inner brain organization. That is called silence in autism. So let's explore how the excessive stimulation, instructions, pressure, noise, anxiety, and constant demands can dysregulate children with autism. While calmness and silence can support attention, learning, communication, and emotional regulation. This is going to be very interesting. But putting them together and relating it with silence is a new concept, but very, very impactful, very powerful concept. Now, when I spoke to Chinu about his journey and about silence, Chinu has narrated a story to me. This story in Chinu's world, Chinu wants to tell to you. So through me, it is a child with autism, now grown up adult who's 25 years, is talking to you about silence. Parents who are here, I'm sure they will connect with their own child. They will realize what child is going through listening to this story. Chino, I don't need the world to be quiet. I just need the world to be kind. Too many instructions, too many things to do. But Chinu says in his own words, my name is Chinu. People say I live in silence. But if you could enter in my mind for one single day, you would realize my world was never silent. My world was always too loud. This is your own child speaking to. You say child is non-verbal, child don't speak, child sits aloof, child likes to be in corner. Chinu is answering all those questions. He says, just enter in my world, in my mind, for a single day. You would realize my world was never silent. My world was always too loud. Not only because of sounds, but because of people. Too many people, too many instructions, too many expectations, too many corrections, too many voices trying to shape me before understanding. And this is my story. This is your child who is talking to you. Chinu's story. 0 to 2 years at the very early childhood, when I was born as an infant and very early childhood, before even I had words. I was born in a world that celebrated noise. People laughed loudly near me. Television spoke all day. Pressure cookers screamed in the kitchen. Doors slammed. Relatives came with excitement. Everyone wanted a response from me. Chino, look here. Smile. Wave bye. Say mama. Clap hands. Nobody noticed that my brain was still trying to understand the first sound before the second one arrived. I was not ignoring the world. I was trying to survive it. Sometimes my mother called my name softly. That felt safe. But then somebody else would say, he doesn't respond. Call louder. And suddenly the room became heavy again. I wish someone knew that even love can become noise when it arrives too fast. When I was 3, the day I became autistic, the day I was labeled as autistic, one day adults around me became serious. They started using a word often, autism. I didn't understand the word, but I understood the change. Suddenly, everybody wanted to fix me. Before autism, I was Chino. After autism, I became a project. And this is the journey all children are going through. The day they have been diagnosed, after that, they are no more children. They are no more Chino. So before autism, I was Chinu. After autism, I became a project. Therapy started, assessment started, goals started, charts started. Everybody wanted progress. Nobody asked whether I was tired. The noise that nobody can hear. Morning school, then speech therapy, then occupational therapy, then behavior therapy, then homework, then practice, then home program. Everywhere I went, someone sat across the table for me, wanting a better version of me. Sometimes I wanted to scream, what about this version? Why nobody is meeting him first? People thought I had behavior issues, but honestly, I was exhausted. Not lazy, not stubborn, exhausted. The day I broke down, I still remember one evening, the TV was on loudly, pressure cooker whistling, someone talking on the phone, traffic noise outside. My mother asked me to wear shoes, my father saying we were getting late. And then another instruction, Chino, hurry up. I screamed, I cried, I threw the shoes away. Everyone thought Chino has a behavior problem. But inside me, something else was happening. My nervous system had simply collapsed. Imagine being asked questions during an earthquake. That is what overwhelm, overload feels like. What means to me? People think silence means no sound. No, silence does not. Silence means safety. Silence means one instruction at a time. Silence means people not forcing me to become normal every minute. Silence means someone sitting beside me without teaching me something. Think about it. For your own child, how many times we sit with our children without teaching something to them? Every time we want corrections, corrections, corrections. In everything they do, we want corrections. How many times do we sit with them in silence without giving them instructions, without expecting things from them? Let them be the way they are. So Chino says silence means being allowed to flap my hands without shame. Silence means not hearing disappointment in people's voice. Silence means a face that says, you don't need to perform right now. That is what means to me. At 8, at the age of 8, I started hiding. People thought I liked corners, but corners liked me first. Under tables, behind curtains, inside cupboards. Those places were quiet. Nobody corrected me there. Nobody asked me questions there. Nobody said, behave properly. Corners gave me something the world never gave me. Pause. The most beautiful moment of my childhood. Now, Chinu is expressing the most beautiful moment. One night, my mother sat beside me quietly. No flashcards, no demands, no say this, speak this, or do this. Just silence. For the first time, I rested my head on her shoulder. And something magical happened. My body relaxed. Do you know why? Because nervous system connect before words do. And for once, mine felt safe. I'm sorry, I'm too emotional while narrating this story to you all because I can relate. Hundreds of children I have seen in my practice facing this every day, every day. At the teenage years, the silent burnout. As I grew older, expectations grew bigger too. Act matured, control yourself, sit properly in public. Why are you still doing this? You are big now. But nobody understood. I was carrying years of overload inside me. People with autism don't only get sensory fatigue, we get people fatigue. correction fatigue, social fatigue, expectations fatigue. Sometimes I stopped talking. No, not because I had nothing to say, but because I was tired of explaining myself. At 18, I began to understand the world. I realized something painful. The world loved loud children, children who performed quickly, children who responded immediately, children who behaved predictably. And I spent years believing that maybe I was wrong for being different. I am different, and I am forced to believe that I'm wrong. Until one day I asked myself, what if my nervous system was never wrong? What if the world was simply too fast? That thought changed me. At 25, this is what I want to tell you today. If you are a parent, Chinu is saying this. Please understand this. I know you worry about me. I know you want me to grow. I know every therapy came from love. But please don't turn my entire life into continuous correction. Sometimes I do not need another command. Sometimes I need recovery. Sometimes I need space. Sometimes I need your presence more than your instructions. Your presence more than your instructions. And sometimes the greatest gift you can give me is silence. I'm not talking about abandonment. So, not abandonment, not ignorance, regulated silence, gentle silence, safe silence, the kind of silence where I can finally hear myself breathe. And my final message is I'm not asking the world to stop teaching children with autism. I'm not asking the world to stop overwhelming them. Because when the noise reduces, I repeat, I'm not asking the world to stop teaching children with autism. I'm asking the world to stop overwhelming them. Because when the noise reduces, you finally see us. When the pressure reduces, we finally regulate. When the expectations soften, we finally connect. And when the silence enters in our lives, for the first time, we stop surviving and slowly begin living. Many children with autism are not refusing the world. They are overwhelmed by it. Sometimes the greatest therapy begins when the world around the child becomes silent enough for the brain to feel safe. So that's all. That's all Chinu had to say about silence. Now, I am talking to you as Dr. Alok Arora about silence. Being a behavior practitioner, I say autism is not just behavior. Autism involves sensory processing differences, nervous system dysregulation, difficulty filtering information, emotional overload, attention challenges, communication processing differences, anxiety, and unpredictability. All of this autism involves. And many behaviors are not misbehavior, they are survival response. As Chinu has said just now, let them live, not only survive. So we don't have to keep correcting them. We don't have to keep giving instructions. We need to give them silence. Silence does not mean I'm asking you to stop therapies. No, absolutely no. I'm asking you to stop school or stop training them, supporting them. No. What silence means is to give them support for regulation. Let's understand the brain overload. A child with autism may constantly experience too much sound, too much language, too many instructions, too much visual stimulation, too many expectations, emotional pressure, social confusion. And this creates fight, flight, freeze, shutdown, and meltdown. Our worries are the freeze. Child suddenly freezes, child does not respond, or child goes into flight mode where child is not responsive, or child goes into shutdown mode or meltdown. But why it happens is because of the brain overload. We treat this as behavioral problem. This is not behavioral problem. This is the brain overload that we need to understand. So the important concept is a dysregulated brain cannot learn properly. Before teaching, before starting therapies, speech, academics, sitting, behavior, social skills, we must first support regulation, safety, calmness, predictability. These are the prerequisites for any therapy that we want to start with. So what does silence really mean? Silence does not mean ignoring the child, no interaction, isolation, or lack of therapy. Silence means reducing unnecessary stimulation, giving processing time, calm communication, less shouting, less corrections, less pressure, more observation, emotional regulation, and creating safe spaces. People who are new here, for you, I want to tell you, these all PPTs, what I'm presenting is going to be shared in the WhatsApp group. We have created a WhatsApp group called Webinars by Dr. Alok Arora. The link shall be probably has already been sent to you along with this YouTube live link by our coordinators, or otherwise you can just request them. They will give you the link and you may join the WhatsApp group. So I'll be sharing all the material, all the PPTs which I present. I always share in the group. So I'll be sharing this PPT also. You may take a screenshot. You may take a screenshot of this part. Silence means silence. What does it mean? And take a printout, paste it somewhere in your house where you can see it at least 10 times a day. At least 10 times a day, your eyes should go there. Automatically your behavior towards your children will change. Automatically you will start giving silence to your children. Need to give them processing time, need to have calm communication with them, less of shouting, less of correction, less of pressure, more observation, emotional regulation, and creating safe space for them. So there are different types of silence in autism. Let us talk about which all types of silence: sensory silence, emotional silence, verbal silence, and internal silence. I'll be talking about all of them one by one here. Sensory silence. Sensory silence means reducing loud sound, TV noise, multiple conversations, sudden sounds, or shouting classrooms. In the classroom also, there are chaotic classroom where you have a lot of noise. So creating sensory silence. Benefits of sensory silence is better attention, less irritability, improved processing, and reduced anxiety. Emotional silence. Children absorb emotional energy. Now, our emotions, they travel in the environment. That is the beauty of emotions. One person in the house is unwell. All other family members feel little down at emotional level. Why do we do that? One person, somebody like husband or wife, had some issues at the workplace. They come back home with anger emotion, with sad emotion. Automatically, the other person, the husband or wife, or the family member, comes to know there is something wrong, some emotions. And emotions travel through energy. So when we can feel emotions of our children, we can feel emotions of our family members. Same, likewise, children can feel your emotions. We are parents. So when parents or adults are anxious, angry, shouting, rushing, frustrated, the child's nervous system becomes unsafe. Calm adults create calm children. So you need to take care of your own emotions, your own mental well-being, your own mental health. A stressed parent can transfer the stress to child, not the learning. So you need to take care of your own mental health as well. That is very, very important. Your own stress, your own emotions, you need to take care. Otherwise, this is emotional energy that travels to the child. And child's nervous system becomes unsafe. Verbal silence. Many autistic children, many children with autism hear too many words. Like sit properly, listen to me. Why are you doing this? Stop moving. Look here. Say this. The whole day they keep on listening. Too many words. And the brain becomes overloaded. So use short language, visual support, pauses in between, and wait time. If you are giving an instruction, you give them time to process, wait. So they need verbal silence also. And finally comes the internal silence, silence within themselves. In general, we never become internally silent. Now, also, when you are attending to this webinar, internally something is going on. Something is going on. You are thinking about it. You are talking to yourself. There's some analysis. Something is happening. Children with autism feel overwhelmed by this, overburdened by such things. So the nervous system needs moments of calm breathing, rhythmic movement, deep pressure, safety input, rest, and emotional safety. Only then can a brain organize itself. Why silence helps in autism? Silence supports brain regulation. When stimulation reduces, cortisol decreases. Cortisol is a hormone which helps us to make strategies and fight under the stress environment. So attention improves. Emotional control improves. Sensory overload reduces. Communication becomes easier. Silence improves communication. Many children with autism need extra processing time, slower communication, reduced language load. When adults speak less and connect more, eye contact may improve, understanding improves, and spontaneous communication increases. Silence also helps in behavior, not only in communication but behavior also. Many behaviors reduce when demands reduce. The environment becomes calm. Sensory overload is managed. Emotional pressure decreases. So sometimes behavior is not a discipline issue. It is nervous system issue. Silence improves learning as well. That's all you want in child. You want child to learn, you want child to communicate, you want child to have the settled behavior. Silence is helping in each area. The brain learns best when it feels safe, regulated, connected, calm, not fearful, not overloaded, not constantly corrected. Common mistakes that we make is constant demands from our children, loud environments, and pressure-based therapies. We don't have to force them for therapies. We don't have to create pressure for the therapies. If I see a polyvagal perspective, a nervous system perspective, when a child feels safe, social connection improves, facial engagement also improves, speech improves, and learning improves. So safety is also a therapy. So let them feel safe. With this message, I want to end the presentation here. The goal is not to control the child. The goal is to help the child feel safe enough to grow. That's all for today about silence. Now, on Sunday, I'll be doing the part 2 of today's webinar about silence. I'll give you strategies for the parents to give silence to their children. Now, you may ask, okay, you have spoken about this regulation, you have spoken about the silence. How do we achieve that? How do we do that? What are the practical strategies? What ways I can do it? So for that, stay connected with me on Sunday at 8 p.m. India time. Again, we'll be meeting on YouTube or on YouTube Live as well as on Zoom, because on weekdays, we do just the YouTube live, but on Sundays, we have Zoom as well as YouTube live, both of it. So in Zoom, you can come face to face and connect with me, unmute yourself, ask your questions. And in YouTube live, it becomes a little difficult for face to face, but still I'm here to answer your questions. If there are any questions, you can just put it in the YouTube chat box and I will answer them. Okay, so I have one message here from Precious Moyo 8731. Good evening, sir. I'm a mother of 7 years old autistic boy. Welcome, ma'am. And if you have any questions, please feel free to ask. Anybody else has questions, you can just Chat, put them in the YouTube live and I will answer them. Meanwhile, please remember, we need to connect with our children emotionally. We need to understand their struggle by stepping into their stones, not stepping into their shoes. I'm sorry. Not by stepping into the world around us. Expectations are too many from every child. Autism is not a disorder. Autism is not a disability, not even a disorder. It is just a difference, a different brain, understanding differently, processing differently, expressing differently. Yes, it's a struggle. It's a struggle for the child. More than us, it's a struggle for the child. Don't feel your children as burden on you. Don't feel that you are overwhelmed only. Think about that child. Connect back with Chinu's story, the earlier one, the previous version, today's version. Understand what child wants to communicate to you, how child is feeling. You remember today, Chinu started with one line. The first line was, just for one day, come in my brain and see what is happening. I have put all my experience about children in this story. You may believe or not. I have just while compiling the story, while writing words, I have literally cried because when I just put myself in the shoes of any child of autism, I understand their world. I understand how they feel. Imagine, I give this example on every platform. Imagine for one day, or not for one day, for few days, you have joined a new job. You are going to the office. New environment is good environment, very encouraging, motivating. Everything is there in the environment. But everybody in your workplace is trying to find corrections in you. You prepare a project, go to your boss and show the project to him. He says, oh, it's good. But this is the problem, this is the problem, this is the problem, this is the problem. Correct it. You go to your colleagues, talk about some letter you have drafted. They say, yeah, that's good. But this is the problem, this is the problem, this is the problem. Correct it. You go to your staff too. You're just having a cup of coffee. Another colleague comes. You offer coffee to him or her. Would you like to have coffee? I'm making one. Okay, let me make one for you also. And she or he sips the coffee and says, oh, coffee is okay. But this is the problem, this is the problem, this is the problem. Correct it. And this continues for a few days. Believe me, you will end up quitting from that job. You will end up resigning. You will not be able to tolerate that environment over 2 weeks. Think about our children who are tolerating this environment for 5 years, 10 years, 15 years, 20 years, whatever the age of your child is. Since the day child has been diagnosed, since the day child has been called autistic, the label, corrections, and stress in the environment. Your neighbor comes home, you talk about your struggle. Child is sitting there, playing, watching TV, doing things. But you feel child does not understand. And you talk about, oh, I can't go there. Neighbor has come to invite you for something. No, 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 you know my situation. I cannot come. How can I leave him? I have to look after him the whole day. He troubles me so much. Or even if you don't use the words, negative words like trouble, but he keeps me occupied. It's my first duty. I have to give time to him. This is your stress. This is your stress that is traveling to your child. Your child is understanding everything. He is non-verbal. He is not able to express. He is non-expressive. But this is what is affecting his nervous system. Your husband comes home. You talk about that. So whole day you keep on talking about your struggle, You talk about your child, you go to a therapy center, you go to a doctor, you meet a therapist, you meet a school teacher. What you are talking about? The struggle. Either the therapist is talking about her struggle with your child, or you are talking about your struggle with your child. Teachers are talking about the struggle. That stress is traveling to the child. In my consultations, I always keep child away. I just do consultation with parent and then call the child if I have to observe the child and other inactivities format or something. Then I call the child later. But my support staff, my juniors, they keep occupied, child occupied outside. So whenever you have to talk about your struggles, not in front of your child. Even if child is sleeping, no, not in front of your child. Please remember this. Your stress travels to your child and affects his or her nervous system regulation. So please stop doing that. There are some questions. Let me have a look at them. Akansha Saxena is asking, what to do if the child goes in meltdown? If the AC is closed, he feels too hot and wants AC all the time. Is why does the child feels too hot? That is something that I want to know first. How the child has been raised. Akansha, take up this question on Zoom. I would request the coordinators to share Zoom link on Sunday because there is an interaction required for this question. I want to understand the environment first. How the child has been raised. If the child has been raised to in the AC environment all the time or not. If the child has been practicing that. What kind of regulations child is going through? What are the concerns that I need to understand? So accordingly, I'll be able to reach to a conclusion. So this question requires either if you are in a or in the webinar WhatsApp group, you can ask me there in the WhatsApp. I will answer it there. I'll send you a few questions. You need to answer them, or on Zoom face to face. We can discuss this question on Sunday. Next is Padma Shinai ma'am. Too much correction causes anxiety and emotional overload. Exactly, ma'am. You are absolutely right here. Too much correction causes anxiety and emotional overload. And that's what we are doing with our children. Who's not trying to correct the child? Morning child wakes up, goes and starts brushing his teeth. We are trying to correct. Child is putting on clothes. We are trying to correct. Child is having breakfast. We are trying to correct. Child is going to the school. We are trying to correct. In the school, when child reaches the school, teachers trying to correct. Child comes back home, therapy centers trying to correct. Evening, parent time, home plan time, trying to correct. What time we are not trying to correct our children? And for what? For expectations, our expectations or social expectations, we are overburdening them with them. Yes, we need to provide support, we need to provide therapies, we need to provide them, structure in a way that they are happy, but they need to express themselves. So we need to provide them silence as well. Dr. Pallavi Goswami, how to make kids comfortable in social environment. Again, Dr. Pallavi, there cannot be one single strategy. In autism, we need to, I can give you 10 strategies, 15 strategies, or 20 strategies. You need to apply and see. First, you need to understand what strategy it is, whether this strategy is fit for this child. So you need to understand your child first. Once you understand the child, pick up the strategies from the list and try it. For this, I am in the process, already work is going on. I am daily, I'm devoting some time and I'm writing a book. Soon that book will be available. My target is to publish it by June 1st week. So that book will be available by June 1st week. That is what I'm targeting if hopefully everything goes right. And for that, I'm taking 1 week's break also. Next week, I'm taking a 1 week break from all my routine work just to work on that thing. And the book is about major concerns in autism that parents face. And I'm giving 100 activities for all those concerns. So concerns, strategies for them, and each concern, at least 100 activities, what activities you can do. But you need to pick up and choose activities as per your child's understanding level, development level, and whether the activity is doable in your environment or not. Accordingly, you need to pick up. So I'm sure from 100, you will get at least two, three, four. Every parent would get two, three, or four activities from that list for the child for different concerns. So there are 25 major concerns I have noted so far. I am completing the 100 activities for each. So 2,500 activities, 2,500. Maybe I was just thinking that this list of 25 major concerns may also increase. But that I will, once I'm done with it, I'll be able to tell you exactly. I'll come back in the webinar and I'll come announce this once the book is ready, and I'll announce that in the webinar. Okay. Uh, any other questions? Okay, as I've already said, we keep on doing these webinars. Pure intention of JKP Care Foundation and my intentions are to support parents and professionals who are in the practice with whatever experience or whatever knowledge I have. Sometimes I may be wrong, sometimes I may be right, sometimes you may not connect with the idea I'm giving it to you or the thought process I'm giving it to you. Please feel free to be vocal about it, talk to me. Maybe I will learn something from you. So on Sundays, we are on Zoom. I'm always open to learn. So anything that I'm telling you here, because I'm coming up with different concepts. So anything that I'm talking about, if you feel that is not correct as per your experience, I'm always open to learn. For me, learning happens from children. Learning happens from parents. Whatever I'm talking, it's the learning from, not from the books, from the children I've come across, from the parents, from other therapists, fellow colleagues I've come across with. So I'm always eager to learn from you. So if you want to say something, please feel free to say it. But if you connect with my thought, if you connect with the subject, please share it around. So we have this YouTube channel on which all these videos are being streamed by JKP Care Foundation. So please subscribe that YouTube channel so that you will get information about future webinars on time, and join our WhatsApp group, as well as share it with other parents so that we can reach globally. We are already I'm seeing parents are already from many countries, from the Middle East, from African subcontinent, from Mauritius, from Vietnam, from Philippines, Nepal, India. But let this approach reach places. So share it as much as possible. Uh, okay, I have another message from GKYC. That's going to be so helpful for all of us. Can't wait to get the book published. I'm trying my best to make it as soon as possible. Thank you for the encouragement. And that's why I said I'm taking a break also from my work. But break does not mean that I'll not conduct webinars. I'll conduct webinars. But I'm taking break from regular consultations for a week so that I can complete things in on time. June is my target. 75% to 80% work has already been completed. This rest 20%. And then it goes for editing. You know how publishing is. It takes a lot of time. So editors have to read and correct, and all those things, corrections have to be made. So it will take a little time, but I'm intending it to do it by June first week. Okay, thank you. Thank you so much. If there is no more questions, I think we can wind up for today. Wish you all the best. My purpose here was not to make anybody um, kind of disrespect any parent. But my purpose today was to make you understand how our children feel and how silence is important for them in autism. So wish you all the best. Anybody has questions, concerns, you want to connect with me, you want to have a one-to-one consultation, you can connect with our coordinators and I'll be happy to help. Thank you so much. Good night.